I'm completely disturbed. I lack words. You know, UDA and Kenya Kwanza have got real bad depths they can sink into in terms of doing terrible things. You think they've gone low, they go deeper. You talk to them, they go even deeper. I mean, who steals from a mother who is about to deliver? Because literally you are stealing from a mother who is about to deliver. She's at her weakest. She's at her most vulnerable. She's bringing life into this country. The people that you intend to start taxing and stealing from. I am telling you, Kenyans, you don't know, you have no idea how terrible this administration is. But I can paint the picture for you. Last week, I went to a district hospital here in Nairobi. And I went through the parking. And I invite Kenyans to go there. And they gave me a ticket, a parking ticket. And I parked because Kenyans had told me what's happening. And I waited for 35 minutes. Then I waited for another 10, 45. When I was coming out, my parking cost was 100 bob. The problem is this. When I paid for parking at a public hospital, my total bill was 100 bob. It looks like a simple thing. But since independence, why have we discovered that now you can take a public hospital and start charging sick people for parking?
I'm shocked.
Number two.
Are you serious?
Actually.
For real?
What we are not seeing is the plan they have. The plan they have is that that's a pilot.
So that's a private company?
Yes. It's not even going to eCitizen. That is what is annoying. That's the question,
because then it ought to be eCitizen.
It is not going to eCitizen. I'm telling Kenyans, go do it. Kuna mahali inafika sasa tunaambiana ukweli. Now, what they have done, or what they are doing, if Kenyans are not aware, wamehesabu the number of public hospitals we have in this country. Level 3, level 4, and like that. So once they see this pilot, they will run it through all our hospitals in the country. And public money, many public parkings, will become a source of money for private companies. And guess what? They are charging sick people. They are charging people who are sick.
You know, I thought it's only done in private hospitals.
No, these guys are sick. They are the ones who are sick. The people who are in hospital are admitted for medical ailments. The people who are doing this business from us should be admitted for mental ailment. Why are we paying parking fees in public hospitals, something that never used to happen? And why is that going to private companies? So when you say Uhuru Muigai Kenyatta needs to talk to William Ruto and tell him about these things, it's because when you're about to open your mouth, they sink even lower. Such an insatiable greed. You can't satisfy these people. And when you thought you've told them they are doing wrong, they do more wrong. What do you want to tell William Ruto that he doesn't know?
If you're going to say the gains made were eroded, then you have a thing or two to share.
You see, William Ruto and his people sat down and literally crafted SHA with the intention of defrauding Kenyans all their money, because it was deliberate. And that is why the Auditor General will come and tell you the money being collected from this SHA is not going to the consolidated fund. So if they have deliberately crafted a plan to steal from Kenyans through SHA and they're executing it, who are you to come and tell them that women are dying? They know. They don't care. The president said he's a consumer of raw intelligence. Now we are giving him raw intelligence. Women have been detained at hospitals. What other raw intelligence does he need? He's not interested in us.
When you see such videos, because there were two, there was the Eldoret one and there is now the Thika, and those are the only videos we have that have come out to the public.
Yes.
When you see such things happen, what does that make you feel, and what should the government do?
You see, when you touch mothers, you touch a nation. And when you enable mothers to deliver, you enable a nation to thrive. Because we are trying to avoid one, infant mortality, but most importantly, maternal mortality. We can lose a child, and I'm not saying it's a good thing, but let's not lose the mother. Because the mother is someone we knew, they grew up with us. You know, this child is not even known to us until this time. So I think for me, the first thing when you talk of Linda Mama, people tend to think it's just availing resources. Linda Mama, for me, and I'm not a woman, but I'll fight for them, is saying that we don't want to lose a sister, we don't want to lose a wife, we don't want to lose a mother, we don't want to lose a cousin. Any lady walking on the streets right now is a candidate for death while giving birth. When you make it impossible for people to be able to deliver at health facilities, we shall see the return of midwives. We shall see the return of people trying to deliver in all sorts of funny places and all sorts of places. Unasikia ati walikata umbilical cord na nini, sijui aliambua squatter kizaa. That rubbish is what we are trying to come out of. So Linda Mama is not a political thing. It's a preservation of the lives of our women. That is very critical. Number two, Linda Mama is not a political noise. Linda Mama is a preservation of the lives of the children who are being born. Because you cannot say you have 60 years after independence and infant mortality is high. One of the things we must do is talk of zero mortality. You see a team member reducing? No. Zero mortality for mothers and for children. So when Uhuru Muigai Kenyatta spoke about it, he spoke about something that is at the core of the nation. We all exist because our mothers were able to go to labor, they were able to deliver, and they were able to come back home with us alive and breastfeed us. So it's a very, very, very sensitive issue. It must be given a lot of weight. It must be taken with a lot of seriousness. Linda Mama is not a political issue. Linda Mama is a life and death issue.
Why do you think?
So when he spoke about it, it's because of what has happened. You've seen clips of a hospital, Thika Level 4, where women were detained in hospital because this rubbish called SHA, and I usually call it rubbish without being afraid, where the Auditor General tells us that money is not going to the consolidated fund. That money is not, it's not working, and women are suffering. And then they hire the deputy president to go around and say wanalinda mpaka baba na watoto. And it's true ni linda baba, because there's money being given to some people and there's no money being given to, the women. It's annoying. So Uhuru Muigai Kenyatta first spoke of that because he knew it's at the heart of the people. It's at the center of everything.
I want